Mania versus hypomania. How to tell them apart. Welcome to this e-psychiatry video where a group of psychiatrists and psychologists working by way of telehealth in Western Australia. Mania and hypomania are sets of mood symptoms that are associated with bipolar. Telling the two apart, so mania from hypomania, can be a challenge as there's overlap with regards to symptoms or features. However, it is important as having a manic episode versus only having hypomanic episodes impacts upon the treatment your psychiatrist prescribes. In a very simplistic sense, hypomania can be considered a less severe version of mania. Both conditions are associated with elevated mood, racing thoughts, loud and frenzied speech, reduced sleep, and grand ideas. Also, there may be impulsivity and poorer judgment. There are popular diagnostic criteria or checklists that are used to make the diagnosis, which state that a hypomanic episode must last 4 days, at least 4 days, whilst a manic episode has to be over a week. However, in clinical practice, this isn't particularly helpful as timelines aren't often clear, and there is sometimes a prodromal phase when people are starting to become unwell. Manic episodes are associated with marked impairment of functioning. When someone is manic, it is very clear to those that know them that they aren't making decisions, aren't thinking, or acting as they normally would. Mania is also associated with psychosis, unlike hypomania. In contrast, hypomanic episode is less noticeable and people may still be able to function to an extent in their workplaces and homes. What also can help telling the two apart is to have the opinions of friends and family who know you well. Often, when someone is experiencing a manic or hypomanic episode, their memory of events is affected. Finally, there is a repetitive pattern of mood changes. A consistent pattern can make it easier to distinguish between the two manic states. So why is it important to tell the difference? Because the current school of thinking is that bipolar 1, which is associated with mania, should be treated differently to bipolar 2, which is associated with hypomania. The research findings recommend very different treatments. That is why it is imperative that you should speak with your doctor, a psychologist or a psychiatrist to help determine your diagnosis if you have had a manic or hypomanic episode. Thank you for watching this video. This is the first of what we hope is an ongoing series of educational videos on bipolar. We hope it has been useful to you. Please send us any feedback that you may have. Thank you.